Are you looking for ways to stay active and healthy as you age? Today we'll explore the top 10 chronic conditions affecting seniors and how to prevent them. Welcome to our health journey together. I'm here to share practical, proven strategies that can help you live your healthiest life after 50. Did you know that over 80% of older adults suffer from at least one chronic condition? The good news? Many are preventable. Chronic conditions are common among seniors, but knowledge and lifestyle changes can help you live vibrantly and independently. Heart disease, diabetes, arthritis, and more. These issues are widespread, but prevention isn't complicated. Small steps count. Today's video will break down each condition, show clear prevention tips, and help you build a healthier lifestyle at any age. Ready to feel your best? Let's jump in and learn about the top chronic health challenges and simple ways to overcome them. Number 1. High blood pressure affects nearly half of American adults over 45, often called the silent killer, because symptoms rarely show early on. Warning signs include headaches, dizziness, chest pain, vision problems. Many seniors feel fine but have high blood pressure. That's why regular checks are so important, even when you feel well. Higher risk groups include African Americans, those over 65, people with diabetes, kidney disease, or family history of hypertension. Weight and inactivity raise your risk of high blood pressure, but small daily habits can protect your heart for years to come. Blood pressure-friendly foods: bananas, spinach, garlic, beets, and low-sodium options. Try a spinach salad with beets or whole grains and olive oil dressing. Too much salt can increase blood pressure. Try swapping salt for herbs like basil, garlic, or rosemary to add flavor safely. Meet Bob. He struggled with leg cramps but improved after watching his salt intake and taking daily 20-minute walks. Now he feels energetic. Question: how often should I check my blood pressure? Weekly or monthly at home is usually best for most seniors. High blood pressure prevention: reduce sodium, increase potassium, exercise regularly, manage stress, limit alcohol, maintain healthy weight, and monitor regularly. Celebrate every healthy choice. Take a deep breath, stand tall, and congratulate yourself for caring about your health. Number 2. High cholesterol affects 55% of seniors, with the bad cholesterol silently damaging arteries and creating health risks. The great news? Lifestyle changes can improve cholesterol in just 6 to 8 weeks. You can't feel cholesterol, but a quick blood test reveals your numbers. Ask your doctor how often to check. Often no symptoms until serious problems develop. That's why the American Heart Association recommends cholesterol screening every 4 or 5 years. Higher risk includes those with family history, diabetes, obesity, sedentary lifestyle, smoking, and diets high in saturated and trans fats. Fatty red meats and fried foods add bad cholesterol. Try lean chicken, fish, or plant-based meals instead. Good fats, like those in nuts, avocados, and olive oil, help raise your good cholesterol. Start your day with steel-cut oats topped with berries and chopped walnuts. Meet Patricia, 71, from Michigan. She reduced her LDL, or bad cholesterol, by 40 points in 3 months by replacing butter with olive oil, switching to oatmeal for breakfast, and walking daily. Big improvement. Question: can I still eat eggs? Yes. Dietary cholesterol has less impact than saturated fat. Focus on limiting fried foods and processed meats instead. Cholesterol management. Eat soluble fiber daily, choose lean proteins, use healthy fats, exercise regularly, maintain healthy weight, and get screened. Like this video if you learned something new. Your support helps more seniors stay informed and inspired. Number 3. Arthritis affects over 50% of seniors and is the most common cause of joint pain and stiffness, especially affecting knees, hips, and hands. But you're not powerless. Movement is medicine. Gentle daily exercise keeps joints flexible and can provide significant relief. Warning signs include morning stiffness lasting over 30 minutes, joint swelling, reduced range of motion, and pain that worsens with weather changes. See your doctor if these bother you daily. Higher risk includes women, those over 65, with joint injuries, obesity, repetitive job motions, and certain autoimmune conditions or family history. Extra pounds add pressure to joints. Losing even a small amount helps. Try swapping high-calorie snacks for veggies or fruit. Anti-inflammatory foods: fatty fish, cherries, turmeric, ginger, and colorful vegetables. Try salmon with roasted rainbow vegetables and turmeric seasoning. Glucosamine and turmeric supplements may reduce inflammation, but omega-3 rich foods and movement therapy often work better than pills alone. Question: will exercise make arthritis worse? Low-impact movement, like water aerobics or walking, is safe for most arthritis sufferers. Start slow and listen to your body. James, 69, from Florida, went from struggling with stairs to playing tennis twice weekly. His winning combination? Pool exercises 3 times weekly, daily turmeric tea, Mediterranean diet, and consistent sleep schedule. Question: are knee braces useful? For some, yes, especially when walking more or doing new activities. Try various styles for comfort. Arthritis management: stay active with low-impact exercise, maintain healthy weight, eat anti-inflammatory foods, get adequate sleep, and manage stress effectively. Don't ignore joint pain. Early movement, weight management, and check-ins with your doctor prevent worse problems. Remember to subscribe to our channel for weekly tips, success stories, and practical advice for strong, healthy aging. Number 4. Obesity impacts about 30% of adults 65 and older. It is a chronic disease linked to more than 200 chronic conditions. It's more than weight. It raises the risk for heart disease, diabetes, cancer, and more. Risk factors for obesity include age, a slower metabolism, lack of movement, and even genetics. But small lifestyle changes make a big difference. Signs include rapid weight gain, fatigue, joint pain, and shortness of breath when moving. Watch for belt, clothing, or energy changes. Healthy foods help. Fill your grocery list with vegetables, lean proteins, and whole grains. Swap chips for carrot sticks or fruit slices. Stay hydrated. Choose water or herbal tea over sugary drinks. It helps you feel full and supports healthy digestion. Question: should I take a diet pill? Only if your doctor recommends it. Most people lose more with healthy foods and walks than with pills. Meet James. He felt sluggish and started by walking with neighbors, choosing fruit for snacks. He lost 12 pounds and felt lighter on his feet again. Question: Can I lose weight at my age? Absolutely. Even 5% weight loss improves health. Celebrate each step. You're never too old to improve. Every small choice, a meal, a walk, a share, gets you closer to a healthier you. You've got this. Has this information inspired you to make healthy changes? Hit that like button to encourage us to create more senior health content. Number 5. Type 2. Diabetes affects 1 in 4 seniors over 65. Diabetes is a disease that occurs when your body is resistant to or doesn't produce enough insulin. Insulin is what your body uses to get energy from food and distributes it to your cells. When this doesn't happen, you get high blood sugar, which can lead to complications such as kidney disease, heart disease, or blindness. Risks rise after age 45, especially with family history, obesity, or high blood pressure. Early awareness is key. Warning signs include increased thirst, frequent urination, blurred vision, slow healing cuts, and unexplained fatigue. Listen to your body's messages. Question: what's a normal blood sugar level? Fasting should be under 100 and 2 hours after meals under 140. Test regularly if you're at risk. Your diet matters. Diabetes-fighting foods include leafy greens, whole grains, lean proteins, berries, and nuts. Try grilled chicken with quinoa and steamed broccoli. 30 minutes of light activity 5 days a week, like walking or swimming, keeps glucose in check. Small steps, big gains. Linda, 64, from California, prevented diabetes by losing 20 pounds through portion control and daily gardening. Her blood sugar level dropped from 6.2 to 5.7. Linda's routine: smaller plates, half-hour gardening daily, walking after meals, and tracking her progress. Simple changes that created lasting transformation. Managing diabetes is about daily habits. You're in control. Celebrate every walk, meal, and smile. We're halfway through our health journey together. Coming up, cancer, depression, COPD, and more prevention strategies that work. Number 6. Cancer affects 20% of older adults. Detecting it early and adopting protective habits truly improves health outcomes. Routine screening saves lives. Ask your doctor about mammograms, colonoscopies, or other age-appropriate tests. Your health provider can give you recommendations on what screenings are right for you. Prevention starts with sun safety. Wear sunscreen, hats, and avoid tanning. Don't smoke or use tobacco. Avoid secondhand smoke in areas where others smoke. Limit alcohol. Swap for sparkling water with lemon or lime for a healthy, refreshing drink. Maintain a healthy weight and stay active. These steps lower risk for many cancers. Eat plenty of fiber-rich foods, vegetables, beans, fruits. They may help reduce cancer risk. Meet Bill. He skipped his health screenings, but a friend convinced him to check in. A quick doctor visit found and treated a small skin cancer. Each healthy choice counts. Sunscreen, veggies, and checkups protect your health at every age. Number 7. Heart disease affects 1 in 5 deaths in America. But here's the hopeful truth. Up to 80% of heart disease cases are preventable. Heart diseases occurs when the heart cannot adequately supply blood and oxygen to all of the organs in the body. The heart might become enlarged, develop more muscle mass, or pump faster in order to meet the body's needs. Warning signs include chest pain, shortness of breath, fatigue, and swelling in legs. Don't ignore these signals. Your heart is talking to you. Who's at higher risk? Those with family history, diabetes, high blood pressure, high cholesterol, smokers, and those living sedentary lifestyles. Sleep is a heart protector. Aim for 7 to 8 hours nightly for strong, healthy blood vessels. Keep stress under control. Meditation, hobbies, or simple deep breathing relax the body and heart. Heart-healthy foods include salmon, oats, berries, nuts, and leafy greens. Try a morning oatmeal bowl topped with fresh blueberries and walnuts. Question: should I take heart supplements? Fish oil and CoQ10 may help, but food sources are best. Always discuss supplements with your doctor first. Meet Shirley, 68, from Ohio. After her husband's heart attack, she started walking daily and cooking heart-healthy meals. Her transformation story is inspiring. Question: how much exercise do I need? Just 30 minutes of walking 5 days a week can cut heart disease risk by 35%. Heart disease prevention summary: eat colorful foods, move daily, manage stress, don't smoke, limit alcohol, and stay connected with loved ones regularly. Almost done with our top 10. Coming up next, depression and anxiety prevention strategies that can transform your mental wellness journey. Number 8. Depression affects 1 in 5 seniors but often goes undiagnosed. It's not a normal part of aging. It's treatable and preventable. Depression causes persistent feelings of sadness, pessimism, hopelessness, fatigue, difficulty making decisions, changes in appetite, a loss of interest in activities, and more. Higher risk includes those with chronic illness, social isolation, major life changes, medication side effects, and family history of depression. Social connection is key. Spending time with family or friends can lift your mood quickly. Reach out, call, text, or visit a friend when feeling low. Connecting brings comfort and perspective. Manage stress with activities you enjoy. Music, gardening, or meditation boost endorphins, those feel-good brain chemicals. Stay active. Walking, stretching, and group exercise lifts spirits and boosts energy. Choose mood-boosting foods. Salmon, walnuts, berries, and dark leafy greens support brain and nerve health. Try yogurt with berries and a square of dark chocolate. Omega-3, vitamin D, and B-complex vitamins support brain health, but sunlight, exercise, and social connection are equally important for mental wellness. Maria, 72, from New Mexico, overcame depression with her wellness routine: morning gratitude journaling, garden club meetings, weekly volunteer work, daily walks with neighbor friends, and regular sleep schedule. Question: is sadness normal with aging? Some grief over losses is normal, but persistent depression affecting daily life requires professional support and help. Question: when should I seek help? If symptoms persist more than 2 weeks, affect daily functioning, or include thoughts of self-harm, reach out immediately. Hope grows with support. Depression in seniors can be prevented. Stay socially connected, exercise regularly, maintain routines, practice gratitude, get adequate sleep, and seek help when needed promptly. Tell us in the comments below, which condition matters most to you this year? Let's support each other as we age well together. Number 9. About 12% of older adults over 65 have chronic obstructive pulmonary disease, COPD. It affects 16 million Americans, mostly from smoking or air pollution exposure. COPD makes breathing hard with symptoms like chronic cough, wheezing, and shortness of breath. Smoking or exposure to smoke, pollution, or workplace chemicals raises your risk for COPD. Avoiding triggers protects your lungs. Who's at risk? Current or former smokers, long-term exposure to air pollution, chemicals, dust, or family history of COPD or lung disease. Stay physically active. Gentle walks, stretching, and breathing exercises help keep your lungs working. Lung-supporting foods, citrus fruits, leafy greens, tomatoes, and foods rich in vitamin C and antioxidants. Try a spinach salad with orange slices. Get annual flu and pneumonia vaccines. They protect your lungs from infections that can worsen COPD. Dorothy, 70, from Oregon, quit smoking and started Tai Chi classes twice weekly. She also bought an air purifier for her home and now goes for annual flu vaccinations. Her breathing improved dramatically, and she now leads hiking groups. Question: can I slow COPD? Yes. Don't smoke, stay active, and see your doctor regularly for better breathing and energy. COPD management: quit smoking, avoid air pollutants, exercise regularly, practice breathing techniques, get vaccinations, and follow medication schedules consistently. Each breath is a gift. Keep moving, stay positive, and know you're not alone. Number 10. An estimated 9% of adults over 65 have asthma, which causes swelling and tightening of the airways in the lungs. It can often be mistaken for COPD or heart problems. Common symptoms are shortness of breath, coughing, chest tightness, wheezing, and difficulty exercising. Common triggers are tobacco smoke, pet dander, dust, flowers, or strong odors. Knowing your triggers helps control symptoms. Prevention tip: quit smoking and avoid rooms with poor ventilation. Vaccines like the flu or pneumonia shot protect your lungs from infections that can worsen asthma. Regular activity helps lung health. Walking or gentle movement is encouraged, but never push too hard if short of breath. Question: can asthma develop late in life? Yes. Don't ignore new symptoms. Your doctor can help at any age. Celebrate every breath. With daily habits, doctor visits, and support, living well with asthma is entirely possible. Conclusion: preventing and managing chronic conditions is possible with smart choices in diet, movement, and support. Every small change adds up. Even one extra walk, fruit, or checkup strengthens your legs, heart, and confidence. Congratulations on investing 30 minutes in your health today. You now have evidence-based strategies to prevent the most common chronic conditions affecting seniors. Thank you for joining our health journey. Subscribe for more senior wellness content, share with loved ones, and remember, your healthiest years are ahead.